Myocarditis and its wide range of causes. The heart is an involuntary muscle that pumps blood around the body. This muscle may be infected with an inflammatory disease called myocarditis. Myocarditis affects the electrical conduction system of the heart, thus affecting the heart rhythm, causing arrhythmia. In addition, myocarditis reduces the heart's ability to pump blood normally, thus affecting the amount of blood delivered to various parts of the body. What are the causes of myocarditis? Studies indicate that 50% of cases where the exact cause of myocarditis is not known, and in this case it is called idiopathic myocarditis. The possible causes of myocarditis are viruses. Viruses are the most common cause of myocarditis. A wide range of viruses are also associated with myocarditis, including the adenovirus that causes one of the common colds, coronavirus that causes COVID-19, parvovirus B19 parvovirus, hepatitis B and C, Coxsackie virus, herpes simplex virus, Epstein-Barr virus, German measles virus, the human immunodeficiency virus, AIDS, HIV, bacteria. Myocarditis may be caused by a bacterial infection, such as Staphylococcus aureus, Corynebacterium diphtheriae, and the bacteria that cause Lyme disease. Parasites. Myocarditis can be caused by some parasites, including Trypanosoma cruzi, which causes Chagas disease, which is common in Central and South America. Breakfast fungi. Myocarditis may be caused by a fungal infection, especially in those with weak immunity, and among the fungal diseases that cause myocarditis, Candida and Aspergillus. Autoimmune diseases. Some autoimmune diseases cause inflammation in different areas of the body, such as the heart. These include lupus and rheumatoid arthritis. Pharmaceutical. Some medications may cause myocarditis, including medicines used in the treatment of cancer. Some antibiotics such as penicillin and sulfonamide. Some anti-seizure medications. Chemical and radiological agents. Exposure to carbon monoxide and radiation can cause inflammation of the heart muscle. What are the symptoms and signs of myocarditis? Some people with myocarditis may not show any symptoms in the early stages, while others have mild symptoms, including source, shortness of breath when exercising or walking lightly or even when resting, flu-like symptoms such as high temperature, tiredness and fatigue, joint pain, cardiac arrhythmia, vertigo, swelling in the legs and feet. What are the complications of myocarditis? Myocarditis usually resolves without leaving permanent complications, but in some cases it may lead to significant damage to the heart muscle, so it may result in the following: arrhythmia, impairment and weakness of the heart muscle, heart failure, the occurrence of a heart attack, stroke, sudden cardiac arrest. What are the types of myocarditis? There are several types of myocarditis, including acute myocarditis. In this type, myocarditis develops suddenly, as symptoms appear quickly and symptoms can also disappear quickly, and this type is often observed in viral myocarditis. Chronic myocarditis. In this type, treatment takes longer than usual or symptoms return. An example of this type is autoimmune diseases. Lymphocytic myocarditis. It is a rare case of myocarditis. In this type, the condition can worsen, leading to hospitalization. What are the methods of diagnosing myocarditis? Because the symptoms of myocarditis overlap with a wide range of other diseases, it is difficult to diagnose myocarditis, so the doctor orders some tests after asking the patient some questions about his health. Among the examinations required by the doctor: blood tests, including a comprehensive blood test, CBC, cardiac troponin, type B natriuretic hormone, blood culture to look for a specific infection, antibody tests, proteins that rise in inflammatory conditions such as CRP. Electrocardiogram. It gives a picture of the heart's electrical activity and heart rate. Echocardiogram helps in detecting structural and functional problems of the heart. Chest X-ray. This can show possible signs of heart failure. Heart CT scan. It gives a detailed and cross-sectional image of the heart. MRI of the heart can reveal some signs of inflammation. Myocardial biopsy. A tissue sample is taken from the heart to be examined for signs of inflammation. How is myocarditis treated? Treatment of myocarditis is based on the cause of the inflammation and the symptoms that result from it. Pharmaceutical. Adherence to taking the medication as directed by the doctor and getting enough rest is often enough to recover from myocarditis, and the medications that may be prescribed in this case are corticosteroids, which help reduce inflammation. Cardiac drugs, such as beta blockers, angiotensin-converting enzyme inhibitors, and cardiac inotropes, which are used in the event of symptoms of heart failure. Diuretics. Surgical intervention. In severe cases of myocarditis, more severe procedures may be used that require admission to the hospital, including implanting a pacemaker, extracorporeal membrane oxygenation. If the heart is severely damaged, a heart transplant is used. What are the ways to prevent myocarditis? There is no specific way to prevent myocarditis, but the following suggestions may help. Get vaccinations. Avoid direct contact with patients whose diseases may be contagious. Attention to hygiene. Maintain a healthy lifestyle.